Dr. M. Srinivas, Director, All India Institute of Medical Sciences, Dr. Vikram Matthews, Director, CMC Vellore, Mr. Riyad Matthew, Chief Associate Editor of The Week, and all the distinguished guests who are present here today, a very good morning, namaskar. My warm greetings to everyone who's a part of this very, very special summit hosted by The Week. It's my immense pleasure to address you all today and present before you Government of India's roadmap for building a healthier nation. Friends, we all understand healthcare is one of the most critical pillars of the society because it's not just contributing to an individual's well-being, but it also promotes economic prosperity and societal stability. And world over, there are numerous health challenges which communities are grappling with, which range from the emerging and infectious diseases to antimicrobial resistance, to mental health risks, to climate health-related risks, and of course, the one which has been pointed out by Riyadji, the growing burden of the non-communicable diseases. And we all also understand that the diseases today are not contained within the national borders. They tend to trespass, and which is why what is required today is not just national action plans, but also global action plans. COVID-19 pandemic has exposed the vulnerabilities of the healthcare systems worldwide and highlighted the urgent need to build robust frameworks, not just nationally, not just domestically, but also globally, so as to tackle any emergencies in times to come. And pandemics can hit us anytime. Today, the major concern of governments world over is universal health coverage. And every country is making steadfast move to achieve universal health coverage. And for a country like ours, universal health coverage is a huge task, considering our population. We have 17% of the world's population. We have 20% of the global disease burden. So when we say that we want to ensure quality healthcare, accessible healthcare, affordable healthcare to every citizen of India, that's a big challenge. But I wish to say, and I'm proud to say this, that Government of India has an unwavering commitment to achieve this. And why I say this is because every single factor which is important to achieve universal health coverage, and there are a host of such factors. The first, of course, is a strong political commitment which Government of India has. We have brought health to our national agenda list. Healthcare is a priority of the government led by Prime Minister Narendra Modi ji. So we have a strong political commitment. The second factor, of course, is that we continue to enhance our healthcare budget. And we're doing that. Riyadji, you just heard him. We have enhanced our budget, and last budget has been 1 lakh crores for healthcare itself. And this is not the limit. Government of India has decided that we will continue to enhance our expenditure on health, build more healthcare infrastructure, expand the medical education infrastructure so we are able to address the shortage of doctors and specialist doctors or other paramedics wherever they're required. Our effort has also been towards providing financial protection to the poor and the needy population. It's also one of the important factors that takes us closer to universal health coverage. And besides these, addressing the social determinants of health. And this is a government which believes in a whole of government approach, which means healthcare is not just the sole responsibility of Ministry of Health and Family Welfare, but every single department of government of India is doing something to make sure that their efforts take us closer to universal health coverage. So when I say addressing social determinants of health, when we launch our pro-poor welfare schemes like providing housing or sanitation, toilets, clean drinking water, clean cooking fuel, and even reducing the carbon footprint, we want to improve the quality of air. We are investing in renewable energy. We have a Ministry of Ayush which is promoting yoga as a healthy lifestyle habit, or Fit India movement. All these are efforts which are today very important if we want to build a healthier India. Apart from addressing the social determinants of health, the other factors which are important are leveraging digital health and technological solutions. Now, innovative technologies are being adopted when we want to ensure a good quality healthcare to our citizens. And we've always kept our focus on universal healthcare, on preventive healthcare. So when we have this vast network of Ayushman Arogya Mandir, today the first step towards preventive healthcare is being taken by strengthening these primary healthcare institutions. So we have completely revamped them. Now every healthcare facility in this country is receiving an NQOS certification. Minimum quality benchmarks need to be achieved, and there is a complete package of 12 different services which are being provided at these Ayushman Arogya Mandirs. And another important factor, apart from keeping our focus on preventive healthcare, is fostering the private-public partnerships. That's one of the very important things to do. And I can give you examples of our programs like Pradhan Mantri Ayushman Bharat Yojana. So there are so many private hospitals which are getting empaneled under this scheme. Pradhan Mantri National Dialysis Program. Private hospitals are, these are being operated under the PPP model. So we are even promoting the public-private partnership. And which is why I said that Government of India has an unwavering commitment towards universal health coverage. And as I said, it's a national priority today. And our focus continues to remain on the three key dimensions, which is accessibility, affordability, and quality. And why I say this is because when we have a larger vision of creating a developed India by 2047, we cannot imagine a developed country without making our citizens healthy. So healthy India is the essential condition for building a developed India, and that is the approach which we have adopted. So how do we intend to do this? We started with our efforts towards the National Health Policy. The National Health Policy, which was long waiting to get revised, and with which we brought a complete review of our approach, a complete transformation in our approach towards healthcare. So healthcare today is no longer just curative. Healthcare does not mean preventing diseases or eliminating diseases or just curing an ill person. There is a complete transformative shift in our approach, and today healthcare encompasses 5 different pillars. There is an approach difference. So it is comprehensive healthcare today, which means there is preventive, there is curative, there is palliative, there is rehabilitative, and there is promotive healthcare. So that's how we started our journey towards universal health coverage. And then continuously enhancing our budget, increasing our government health expenditure. Today, government health expenditure in these past 11 years of our government has increased from 29% to 48%. And the out-of-pocket expenses on medicines or implants or medical devices, all those expenses have come down from 63% to 39%, and that has not happened by some magical trick. There are very precise steps which have been taken to bring down the out-of-pocket expenses. Host of our schemes, and I mentioned to you a few. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which provides a free of cost treatment, secondary and tertiary care hospitalization worth 5 lakh rupees to 62 crores Indians today. Pradhan Mantri Dialysis Program, Pradhan Mantri Jan Aushadhi Program, Amrit Pharmacies. These are steps which have been primarily responsible for bringing down the out-of-pocket expenses. And you have seen the recent GST 2.0. What a major decision we have taken. So many of our life-saving drugs, even health insurance. People in India don't want to take a health insurance. They'll insure their car, they won't insure their health. So we want every citizen to take a health insurance, and that is why there has been a tax reduction. So Government of India has been thinking holistically on how we have to build a healthier nation. Over these 11 years, there has been a record expansion of medical education infrastructure and tertiary healthcare facilities. So one of the All India Institute of Medical Sciences director we have here, Dr. Srinivas, and we know the amount of burden AIIMS Delhi has. So we decided that this has to go down. And why people from Kerala or people from Tamil Nadu or people from Orissa need to come to All India Institute of Medical Sciences Delhi? Why can't we have more All India Institute of Medical Sciences across the country? And which is why the number of All India Institute of Medical Sciences today has gone up from 7 to 23. And this has happened in just 11 years. Ladies and gentlemen, this happens when the policy making is visionary. And it is backed by strong implementation. That's when such meaningful changes can be seen. And this is what India is witnessing under the leadership of Prime Minister Narendra Modi ji in the NDA government's regime. So medical colleges now have gone up from 387 to 802. I think 1 year back when I came to this summit, I quoted a different figure. We've made an increase. So virtually every district today has a medical college. We want to reduce the burden on our tertiary healthcare facilities, so we are strengthening our primary and secondary healthcare infrastructure. I mentioned to you about the Ayushman Arogya Mandir, the first point of contact, a primary healthcare facility which exists in an urban setting, in a rural setting, the first point of contact for a common man. That is being strengthened. Then PM Abhim, our health infrastructure mission, that is fixing up the critical gaps which exist in our secondary care facilities. And the tertiary care facilities are also being created. But when you strengthen your primary and secondary level care, the burden on tertiary healthcare automatically comes down. Today, we want to address the shortage of doctors and specialist doctors because that has long been spoken about. I think in every conclave, every discussion, we don't have doctors, we don't have enough specialist doctors. You go to the rural areas, people are still waiting in long queues, there's no doctors to see them. That won't happen in next few years because the new All India Institutes of Medical Sciences that have come up, the new medical colleges that are coming up, and I just told you the number. And the constant increase in the MBBS seats, in the PG seats. So in times to come, few more years, you will have a new generation, a new pool of doctors, specialist doctors, and even nursing staff, because wherever we have set up a medical college, we are also co-locating a nursing college. So there is going to be no shortage of the human resource when it comes to medical healthcare. And ladies and gentlemen, these are not just schemes and programs and initiatives. This is not just a story of, okay, we are introducing one scheme after the other. What is the measure of the efforts that we made? That is the impact which has been created. And what is the impact? We will know whether we have succeeded or we have failed only when we see that there is a meaningful change. And we have so many success stories. Today, India is being certified as maternal and neonatal tetanus free. India is being certified by the WHO as being trachoma free. India's efforts towards MMR, bringing down MMR, bringing down IMR, they are being recognized globally. And we have been acknowledged as being an exemplar performer because the decline in MMR and IMR of India has surpassed the global decline. That has happened because of concerted efforts. You were mentioning about tuberculosis. Yes, we have resolved to make India TB free. And it is not just a resolve for political slogans. When we say we want to make India TB free, yes, we want to do it. And that is why this 360-degree approach is being adopted. And we can see the results. The incidence of TB has come down, 17.7% decline in the incidence. 21.4% decline in the mortalities. TB treatment coverage has expanded by 32%. And look at our initiatives. We want to eliminate TB by involving every citizen of India. So everything today is a Jan Bhagidari Andolan. It's a people's movement. And in our government, we believe that lone government efforts cannot help us achieve the bigger aims, the larger goals. And involvement of 142 crore Indians is very, very important. So today, when you hear words like Nikshay Mitra, that's actually an effort to engage the common man of India in a fight against tuberculosis. We are finding innovative solutions. We just last year, around this time only, 7th of December, we started this intensified campaign. So under that intensified campaign, we went to the remotest corner of this country. We went to the vulnerable population groups. And we were able to screen and then identify more people, TB patients, and we put them on treatment. So when I say we want to create a TB-free Bharat, TB-Mukt India, we are leaving no stone unturned to achieve the same. And there are so many other issues. Our One Health preparedness, now animal health, human health, plant health. We have a big action plan. We are preparing our country for any future health emergencies, antimicrobial resistance. We do have a national action plan. And India is doing very well on all these pillars. And when we say India has a huge population and the intent is to leave no one behind. When you say universal health coverage, it means leave no one behind. And then you see 142 crores, my God, what to do? So we need to adopt the digital health solutions as well. And I'm very proud to say that India is one of the preeminent nations in adopting those technological and digital health solutions. Ayushman Bharat Digital Mission is one of our biggest efforts to create a digital health ecosystem. Today, so many unique Aadhaar accounts have been created. And you know about this whole effort that we want to bring our healthcare practitioners, we want to bring our pharmacies, everything on a digital platform. We are giving a unique ID to every citizen of India, and they can access the services of professionals, they can find out the pharmacies, everything to this digital health ecosystem. So many people have been onboarded, their Aadhaar cards have been created. So when you hear about Aadhaar, you hear about our national telemedicine network, which is e-Sanjeevani. And e-Sanjeevani did a wonderful job during COVID. People were taking free consultations online. E-Raktakosh, UWIN, CoWIN. And you must have seen the Prime Minister launch the medical drone services from many of our All India Institute of Medical Sciences. And we know how it is revolutionizing healthcare delivery. So medical drones and centers of excellence for AI being set up at All India Institute of Medical Science, Delhi, in PGI, Chandigarh, and I think one more, I'm forgetting, maybe Dehradun or someplace. So technology, digital health solutions, all that is also on our agenda. And one more thing, I would like to say that we have learned our lessons from COVID. And we realize today the importance of self-reliance, not just when it comes to medical education infrastructure, healthcare infrastructure, but also when it comes to the availability of drugs and medical devices. So Government of India has started these PLI schemes, PLI scheme for boosting the domestic manufacturing of the medical devices. And I'm very happy to say that many of those medical devices which were totally imported in the past are today being made in India. That's the spirit of Made in India. PLI scheme to boost the manufacturing of the critical import-dependent APIs of bulk drugs. PLI scheme to boost the manufacturing of the other high-value drugs, the in vitro diagnostics, and the other not so critically important bulk drugs. Medical devices parks are coming up. Bulk drug parks are coming up. So it's a very holistic effort. And besides all what the Government of India is doing, I would say that health is a shared agenda. And what we need is sabka saath, collective effort. So policymakers, researchers, scientists, healthcare practitioners, our industry captains, innovators, media, everybody needs to join hands. We all have to contribute in some way or the other. Of course, one of the way forwards is collaboration, and Government of India is promoting those collaborations. There are so many ways in which we can join hands and contribute in co-creating solutions that address not just the unique health challenges of India, but even for those living beyond. So today, I would appeal to this esteemed gathering that we all collectively adopt healthcare as a priority and contribute in whichever way we can to build a healthier nation, because only a healthy India can be a developed India. And with this, I once again congratulate the week for hosting this very meaningful, very timely dialogue. And this is the second edition. My good wishes for the success of this summit. You've chosen some very beautiful themes for discussion in the next rounds. And thank you very much for inviting me and giving me an opportunity to share some of the good work that Government of India has done so far, and we intend to do a lot more. Time is short. I have tried to put up in very little words, but there is so much that Government of India has done and we aim to do. Maybe on some other occasion, I'll have an opportunity to discuss more. Once again, thank you very much for your patience. Jai Hind.